or 20% of the population is 65 or older. As you look down at Indonesia, it's somewhere in the 7 to 10 or 7 to 13% of the population. But those numbers are expected to change. So as physicians, when you're preparing for medical practice, you need to recognize that you're going to be practicing in an aging world. By 2050, it's expected that 80% of older people will be living in low and middle income countries. In 2020, the number of people over 60 years of age outnumbered the number of children under 5 years of age. So globally, our population is getting older. And the population of people over 60 years of age will double between 2015 and 2050. So this is something that you need to be aware of as you're going through your medical practice. So let's take a few moments and talk about the impact of lifespan. I've got vital signs from a patient here. Blood pressure's 88 over 37, heart rate's 128, respiratory rate is 40 beats or 40 breaths per minute. So as we look at this, what is the assessment for this individual? Are they healthy? Are they in trouble? Do you have a level of concern about their vital signs? If this was an adult, you should be very concerned, but this is actually the normal vital signs for a 1-year-old. So as you look at changes with lifespan, it's important to recognize that a child is not a small adult. They have a completely different physiology. This graph shows the differences in blood pressure as you age. When you're 1 year of age, a normal blood pressure is somewhere around 88 over 37. It's only when you get to be over 10 years of age that you start to have a systolic pressure over 100. So if you go into pediatrics, if you're ever dealing with anybody over lifespan, you're going to have to relearn the physiology. You're going to have to relearn what your expectations are for normal. At what age does a child's brain size reach the adult size? And for this one, I'll ask you to type it again into the meeting chat. People seem to be settling on choice C as the option, somewhere in the 10 to 12 years of range. It's actually much earlier than that. As you look at the child's development, the brain mass reaches the adult size at somewhere in some 6 to 8 years. So even when you look at pictures of babies, pictures of children, the head appears disproportionate in size to the rest of the body. You'll see this in dolls, and this is not only humans, this is in the animal kingdom too. That idea of the head being much larger than the rest of the body elicits a natural protective instinct. This is recognized as somebody who is not yet completely developed. So animal toys, stuffed animals, dolls, all show this proportional head much, much, much larger than the adult ratio of head to body size. So as you graph it out, the brain development for children reaches the adult size somewhere around age 6. In contrast, the height does not reach the adult size until somewhere in the late teens. The dentition, teeth, also reaches the adult size much earlier than the height. And the reproductive organs don't begin to mature until after you hit puberty, somewhere around 10 to 15 years of age. Looking again at the changes in height velocity, centimeters per year, infants grow at a massive rate. Within that first year, they almost double their body length. If we would look at that rate of growth in an adult, you would go from being 6 foot to 12 foot tall within a 1 year period. So the children's physiology is markedly different than what it is in the adult. That rate of growth diminishes as you go through infancy, it plateaus in childhood, and then once you hit to the youth and adolescent, there's an earlier acceleration in growth in females and a later acceleration in growth, which occurs in males, which is tied to the onset of puberty. The body water distribution is also markedly different as you look across age. So as you look at the extracellular fluid volume, children are much more than half of their body weight is in the extracellular fluid volume. That means that, and children turn over their body fluid very rapidly. They turn over about 1/6 of their body weight each day in fluid intake, fluid output. So that means for children, something like diarrhea is a life-threatening emergency. They turn over such a large proportion of their body water that they can get into trouble very rapidly. In contrast, by the time you look at the adults, the extracellular fluid volume is somewhere around 20% of the total body weight. So the adults with diarrhea, it's not nearly the life-threatening event that it is for children. So as you consider stages of life, adulthood is the attainment of a physiologically optimal integrated function. But it's not appropriate, it's incorrect to say that changes with aging are abnormal. So there are three observations as we're looking more carefully at the body's responses to aging. There's a much greater variability in the response. The changes in function do not occur simultaneously, and they don't occur to the same degree. So we should not really view old age as a disease, nor should we put a time clock or an expectation on what happens during aging. As we look at the significance of human aging, lifestyle is a primary factor. Gender is a significant factor, and yet there are various theories attempting to explain the aging process, but at the bottom line, there's a disruption in homeostasis. So why is it important that we start doing more detailed studies in understanding age? If you begin with somebody who's age 50 and look at how many more years of life they have. Today, they've got about 30 years worth of more life. So a 50-year-old woman is going to live on average to the age of 81. If we cured cancer, that would increase to about a 35-year response. If we cured heart disease, it might go up to about a 37 years. If we cure cancer and heart disease together, that still only results in about an 8-year improvement in longevity. If we fix cancer, heart disease, stroke, diabetes, then you'll pick up about a 15-year expansion in longevity. If we find some way to slow down the aging process, then we can get adults to live functional lives into their 100 and teens. So this is why aging is such an important topic in terms of medical research these days. This graph shows the body mass index for individuals of various ages. The line color indicates what age they are. And my experience has tracked this graph pretty closely. When I was in my 20s, my BMI was down at around 25. Because I was playing sports, I was good and active. By the time I got into my 50s, I was no longer playing sports. My BMI was actually much closer to 30. And now through diet and resuming exercise, I'm bringing my BMI down to about 29 or so. So the peak BMI is happening somewhere in the 50 when you're in your 50s, and then you start to get some improvement. You start to be able to bring it back down more toward a normal BMI. So as we look at the physiology of aging, the major changes can all be tied to a loss of compliance. The elastic tissue becomes much less stretchable. The consequence of that for the heart is you get ventricular stiffening. That's going to decrease both ventricular filling and cardiac output. In the blood vessels themselves, you end up with an atherosclerotic process. That means that systolic pressure is going to rise and diastolic pressure is going to fall. In the respiratory system, you have a decreased breathing volumes. Kidneys, there is a nephron loss as you age. For skeletal muscle, there's atrophy of muscle fibers, but most notably in the fast twitch fibers. The slow twitch fibers do not seem to have quite the rate of atrophy that fast twitch fibers do. Reproduction, you have both menopause and andropause as individuals age. So for males, as we look at the plasma testosterone, for the first 3 months, there's a peak in plasma testosterone during the first year of life that then once you get to that first year and then you go through childhood, there's not much of a change in your testosterone. Then as you hit puberty, testosterone levels reach their maximum. And then once you get above 60, there's a gradual loss in testosterone and a loss in the secondary male sexual characteristics. Similarly, females show a very high FSH and LH in both in utero and during the first year of life, but then nothing until they hit puberty. And then with the onset of menopause, the FSH and the LH levels rise, but the ovaries are no longer responsive to it. So you do not get the estrogen and the progesterone production that normally had been stimulated by FSH and LH. The sensory system is susceptible to degradation with age. For vision, there's a presbyopia, which is a loss of accommodation. I'm now wearing reading glasses to help read things. For hearing, there's a presbycusis, which is accelerated by aging. Taste and smell begins to degrade somewhere in the 60s and 70s. And what will happen is older people will tend to like spicier foods because of that loss in their baseline taste and smell. Touch, pressure, and pain become much less noticeable as you age. But none of these are really a problem. The body has excess capacity. There's a decline in the peak performance, but there's plenty for normal activities of life. Physical condition seems to be driven by lifestyle choices such as stress management, exercise, nutrition, genetics, and environment. This is a picture of an American actor, Robert Redford, when he was at age 64. I did not look at like this when I was 20. So genetics plays a significant role in the body form as you age. So the current areas of research which are promising are the caloric restriction and the altered dietary intake. There's a whole lot of work on IGF-1 and pharmaceuticals. Most, if not all of these, have a similar goal of targeting reactive oxygen species, underscoring what appears to be a substantial role of oxidants in the aging process. So Google says there's a lot of interest. When I asked it about aging, I got almost 700 million hits. If I asked about anti-aging, about 35 million hits. Google Scholar is somewhere around 5 million. And in the United States, our National Institutes of Health has a National Institutes on Aging, and that's funded with around $4 billion in 2021. So what can you do about this? How are you going to adapt to aging? And exercise training seems to be a key characteristic. if you were trying to recruit Usain Bolt for your sprint team, the Jamaican sprinter won the Olympic gold at the 100 and 200 meters over a period of 8 years in 2008, 12, and 16. What age do you think he was at his fastest? If you're trying to recruit him, which of these ages do you think would be ideal for recruiting him as an athlete when he's going to run his fastest? Again, type your answer into the chat box. Okay, so there's a little bit spread of answers, but most people seem to settle on C. And that's the age he was when he set the world record for sprinting. In contrast, if you were to look at someone running a 10-kilometer race for males, at what age do you feel that that performance should decline? Okay, you've got 7 choices up there. Six choices up there. Okay, we're bouncing back and forth between C's and D's. C seems to be taking a slight lead on things. And it's actually D and E. So there's a difference between the sprinting, which is mostly fast twitch muscle, and a 10-kilometer race, which involves slow twitch muscle. So as you look at the changes with age in the different running records, so it goes, which one is the fastest, the record speed for men and women when you look at the 100-yard dash, 100-meter dash, the fastest speeds are going to occur somewhere in the mid-20s for both men and for women. Then by the time you get to be 30, those speeds slow down. You can't run nearly as fast, and it's a fairly steep upstroke. Once you cross that 30, you're on a good linear portion of the curve. In contrast, for looking at the 10-kilometer race, that curve stays flat for a much longer period of time before you start seeing an upswing when the speeds are going to decrease. And this underscores the difference between fast twitch and slow twitch muscle loss as you age. So as you look at the strength changes with aging, the maximum strength decreases and the muscle mass decreases. The percentage of slow twitch muscle fibers actually increases as a percentage of the total fibers, but the size and the number decrease. There's a nervous system response slowing, but this is not due to vasculature. This is not due to mitochondria. This is not due to any of those other components. When you look at cardiorespiratory endurance, the central and peripheral circulation decrease. The aerobic capacity decreases by about 1% per year, as does the maximum heart rate. So both stroke volume and cardiac output decrease. So in looking at studies of older athletes, there are individual differences in the rate of decline with aging. Prior training does not provide any real advantage to endurance capacity later in life unless you stay active. As soon as you become inactive, the muscle changes accelerate very quickly. If you keep your intensity and volume of training high, the rate of loss of cardiovascular function with aging slows, especially between ages 30 and 50. After the age of 50, it doesn't really go very much. So there's a whole lot of research as you look at athletes being trained with a high intensity and the gradual decline in their ability versus the non-athletes being trained. As soon as you stop training, then the decline in function happens very quickly and you rapidly join the performance levels of individuals who never have been active and trained. In terms of the respiratory changes with aging, the vital capacity decreases, as does the residual volume increases, all going back to that loss of elasticity. Total lung capacity remains unchanged, but a smaller proportion of that is in your vital capacity. Your minute breathing maximum decreases after maturity, and that's because of the loss of elasticity in both the lung tissue and the chest wall. I saw a very interesting presentation 2 months ago where an individual was looking at the reason why elderly individuals had a much higher death rate when exposed to the COVID-19 virus. And a lot of this came down to the fact that when you look at the diaphragm is a mix of slow twitch and fast twitch muscles. The slow twitch is the one that's used in regular respiration, but the fast twitch is the one that's used in coughing. So as individuals aged and lost that fast twitch capability, they then were not able to cough nearly as effectively and clear their lungs when the infection had taken place. So the blockage of the lungs ended up being a major cause for mortality in individuals who are older. So the key points for respiratory aging and performance, endurance training in middle and older age reduces the rate at which you lose that elasticity. Pulmonary ventilation capacity are only slightly decreased with aging, and the limits for oxygen transport are the main cause for the reduction in the VO2 max in these individuals. So the standard calculation for heart rate is 220 minus your age. So now I'm 71 years old. That means my heart rate maximum is 149. My resting heart rate is already over 50% of my maximum heart rate. So I'm essentially my cardiovascular system is doing exercise just by waking up in the morning. That heart rate maximum decrease is due to a drop in the sympathetic nervous system activity, as well as the changes in cardiac conduction. The stroke volume max is due to changes in peripheral resistance and left ventricle contractility, and the cardiac output max is due to a decrease both heart rate and stroke volume. So the thing to take home from this is physical training can help offset age-related changes in body composition. So as you look at the training for the older athletes, you get similar gains regardless of their age, sex, or initial fitness level. But the data now very clearly shows that resistance exercise is by far the most effective at maintaining body function as individuals age. When you look at the changes with body changes, diet, and exercise, the total body weight change with your diet drops down to around 17. As your body fat drops and the fat-free mass drops much less so. In contrast, for exercise, you're increasing your fat-free mass, you're increasing your muscle mass, and particularly when you combine diet with exercise, that by far is the most effective way to diminish the harmful effects of inactivity. So where is physiology going to figure into all of this as we move forward? As you look at the roles of physiologists in supporting a healthy society, the physiologist should help set the roles for determining goals, evaluating the outcome, and then model the appropriate behavior. The goal of this is to reduce the disease burden, reduce health inequities, and identify that wellness is more than just the absence of disease, so that both individuals and groups can flourish. In terms of individual wellness, you're living in an age where there's going to be a dramatic shift in how informed individuals are about their physiology and their normal body function. My daughter competes in triathlons, and so she very actively monitors her physiological state. So she's got one of these Aura rings, and with that, she regularly monitors her REM sleep patterns. This the monitoring is sufficient so that it will say, okay, it's now a little bit before 10 o'clock. It's time for you to go to bed. This is the optimum time for you to go to bed to get the most rest. It looks at the activity goal for where she's maintained things. It looks at the oxygen saturation over the course of the day and plots it, as well as looking at the resting heart rate based on her levels of activity. So she sees what the heart rate is at rest, and then over the course of the day, what heart rate, what activities she did, and what her heart rate responses to those activities were. And it's not only the Aura Ring, the smartwatches, this one costs about $150 US, gives much that same information. Here she was wearing both the ring and the smartwatch, and it gives her weekly timetable. It tells her when her body's energy is at its highest, when her energy has been expended too low. And she went in for surgery and had 2 days of inactivity. And you can see the body, what they term the body battery, her energy supplies decreased dramatically during the surgery based on her food intake, being confined to bed rest. And so this individuals are now going to show up to your office with much, much, much greater information available to them as they monitor what's going on within their body. She and her husband were also trying to have children at the same time. And it's possible to get Easy at Home, which is a hormone testing program. And that hormone testing program looks at FSH, LH, and HCG. So it's monitoring her ovulatory cycle to let her know where the peak fertility is and what the optimum days are to have intercourse if you're trying to get pregnant. So it plots out the ovulation over each month and says, okay, these are your times of peak fertility. This was unheard of. This level of detail when I was a student was not available in even research labs doing this. Now you can buy these things in drugstores. This information is available over the counter in pharmacies. So as you look at the roles of physiologists supporting a healthy society, it's going to change. There's going to be a much greater emphasis on health as being more than just the absence of disease, but what you as clinicians are going to be recommending and prescribing in order to maintain a healthy society. So for population wellness, you're going to have to educate your patients about the impact of lifestyle choices, about the effect of aging, and the impact of climate degradation. For physiologists, our focus is mostly going to be on lifestyle promotion, which means we've got to do better research so we understand more precisely what's going on, and then disseminate that research to a wider audience. We should be championing healthy aging. And I'm doing this myself. I'm adopting all of the best practices that I see being recommended by the different research studies that are going on. So for lifestyle, there are going to be all kinds of articles that are involved in changing lifestyle, but your patient question is always going to be, how much longer do I have before I have to change to a healthy lifestyle? People don't automatically adopt that healthy lifestyle. They usually have to have some impetus in order to do so. And the physiologist should look to partner with existing programs and expand the evidence base to promote health. So as you look at your medical practice, in the 1900s, physician practices were all acute. It was one physician, one patient, and the encounter was generally in the clinic. This is moving to chronic interactions. The physician is only one member of the team, which is helping provide care for the patient. The focus is going to be much more on population health and work within the community. So at the conclusion, growing older is still better than not growing older. So with that, I'd like to thank you for your attention. I'll be glad to answer questions in the chat to the best of my ability. And thanks again for paying attention. Please type any questions you have in the chat box.
Yeah, Dek. Okay, thank you very much, Prof, for the insightful presentation. Now we'll begin in our question and answer session. I encourage all of you to actively participate. Please, maybe you can directly ask
Yes.
Prof. Rob.
A question in the chat is, when a person gets old, they will return to childhood. What do I think about that? Not cognitively, they may go back and relive things in their childhood much more. They recall them better, and they remember them better. And those childhood is generally a good time for most individuals. So it's a comfortable place to go and to muse about things. But it's more just reflecting on life rather than behaving more in a childlike manner.
Oke, Dek. Bisa juga langsung di-unmute juga bisa ya, Dek?
Nanya secara langsung.
Secara langsung juga boleh. Please use your raise hand reaction maybe.
Oke, satu aja dulu itu nanya. Saulia Konaan.
Oke, maybe Muhammad Duiful Dopresia. Please.
Thank you for the opportunity. So, Professor, I heard somewhere that running makes you age earlier. What do you think about that?
We have an individual in our department who says that you have a fixed number of heartbeats, and when you exercise, you use them up more quickly. That is not true. So it depends on how you are running. If it is a fitness, aerobic exercise is essential to slow down the aging process. So if you're trying to run marathons when you're in your 70s, that's tough. That's going to provide a lot of wear and tear on the body. I know I used to run a fair amount when I was playing sports. Now I just walk fast. Running, my knees won't take the impact from running anymore, but I make sure I walk 5K in the morning every morning just to make sure I'm getting some aerobic exercise. So no, the running does not, your joints will tell you when it's time to shift to another form of exercise. The question in the chat is about the telomere length. Yes, that's people looking at samples where they look at the reduction in telomere length can produce a very good estimate of the aging damage that has been done. The question is, what can you do to diminish the rate at which that damage is done to the telomeres? And that's where it comes down to the oxidative stress on the system. So we have a number of hands raised. Dr. Diaz, if you would moderate this.
Yeah, Prof.
Oke, next. Siapa? Nanya siapa lagi ya? Itu namanya
From Beta, maybe direct.
Indah Salwa.
Yeah, Indah Salwa
Indah Salwa.
from Beta class.
All right, thank you so much for the opportunity. I would like to ask about muscle loss as we age. So, as we age, muscle loss happens naturally. Could this be an adaptive process rather than just a sign of decline? For example, does muscle loss in aging help the body conserve more energy for more essential functions? Thank you, Professor.
Okay. Thank you for the question. It's actually an excellent question. I am not sure. I do know that the impact is across species. So humans are not the only ones who show that decrease in fast twitch muscle with aging. But what is the physiological, the evolutionary advantage for this happening is I've not seen a good explanation for that. In terms of the survival of the species, once an individual is past their reproductive years, they're not really contributing to the longevity of the species because they're not producing any new offspring. The exception to this is when knowledge becomes important because the older individuals are repositories for knowledge. Their knowledge will help the group survive more effectively. So the individuals or groups in which older individuals are of more significant benefit are where those individuals are the sources of knowledge, the sources of the shared experiences for individuals. But I'm not seeing whether or not that the decrease allows the lighter or the impaired cardiac output or the lighter performance to be a benefit. But that's a good question. It's an interesting thought. Thank you.
Oke, next.
Okay, thank you, Prof. Maybe from the Gamma class, Anissa Vira Syafitri, and then Oliver Felix Kiani.
All right, thank you for the opportunity. I would like to ask two questions actually. The first one is I want to ask about to what extent can a skincare that claims to have anti-aging effects actually works, and how does it actually works? How is the physiology behind it? The second one is there any recent breakthroughs in anti-aging research that have actually shown real measurable effects? Thank you.
Okay. Yes. Again, two very good questions. For the skincare, most of the appearance in elderly individuals of wrinkled skin is more tied to sun damage. So individuals who wear a lot of sunscreen, things like that, do not show the age-related changes. The other is the skin, you lose the subcutaneous fat in the skin. So areas that used to be supported from underneath and plumped out by subcutaneous fat no longer are. And that also contributes to the wrinkling. The third would be the hydration status of the individual cells. So you'll see a lot of moisturizers being recommended because as you make these cells hydrate, they swell up. And again, that gives the appearance of smoother skin because the skin is more tightly, more taut, more tight. The damage to the skin, prevention of the sun exposure is one way to diminish the damage. But once the damage is done, you can cosmetically obscure it, but you can't really fix it effectively. So as all of those products, they usually show, okay, this is the before picture. Now after treatment with the drug, look how nice and full the skin looks. And then you look at the person 12 hours later and they're back to where they started. So it is a temporary treatment. The second question was, what was the second question?
Is there any recent breakthrough in anti-aging
Okay,
uh,
yes.
research? Thank you.
Sure. The only one that has been consistently productive is caloric restriction. And that goes for everything from paramecium through humans. If you restrict the caloric intake to about 30 if you look at the basal free-ranging caloric intake, it's called ad libitum, when an individual just eats as much as they want. If you reduce that number by 30%, that dramatically increases the lifespan. And it's thought of that with the reduced caloric intake, that does cause a reduction in the amount of free oxygen radicals that get produced. So that will result in less telomere damage, less damage to the proteins, all of the things, less damage to the DNA. So there's a decrease in the rates of cancers, things like that. Now, the bad news is I don't want to be hungry for the rest of my life. So it's not a desirable, it's not something that you can widely recommend for everybody to adopt. But for animal studies and for human studies who individuals have chosen to live like that, it dramatically improves their both lifespan and slows down the rate of decline of their body functions.
Okay, Oliver, please.
Okay, thank you for the opportunities. So actually, Prof, I'm still curious about the body of athletes itself. So a lot of soccer players that I know often do unhealthy lifestyle, like drinking alcohol, and smoking and others. But until they are old and past their performance period, they still look healthy and don't look like they're having trouble like people who don't do training. So yeah, what happens to their body physiology at their all age, maybe?
Sure. One of the slides that I put up showed what happens if you take trained individuals and you continue to train them where they have a very slow degradation from aging. But if they would completely stop activity, they then catch up to the group that's never been trained. So as you look at the individuals who have been physically active, it's sort of easier for them to stay active. It's because I played sports that I'm very comfortable with taking the hour it takes me to do my morning exercise. And it's just a habit you get into. So I'm able to remain active more than like my wife, who did not play sports. She has to make a conscious effort to get out and exercise in the morning, where for me, it's just part of the waking up process. I wake up, I exercise. So it is just the training. Now, about the unhealthy lifestyle side of things, when I was playing sports, I was always disgusted by my teammates who would be smoking and drinking and not doing things. It was sort of, and they were still better athletes than me. But it was, if they wouldn't do that, they would have been even better athletes. So uh, genetics plays a large role in what the ceiling is for how good you can become. And then the training and lifestyle says how much of that ceiling you can actually realize in the performance.
Okay, thank you, Prof. Maybe now, Alpha class, Irene, Melvin, and then Inshira.
Okay, good evening, Professor, and thank you for your lecture and this change to ask. So I have a few questions here. It was mentioned that the major physiological change in aging is loss of compliance or elastical response. So my question is, in general, what causes this condition? What causes the compliance in an individual gradually decreasing as they get older? And my second question is this condition reversible? Like, I mean, is there any way or any change that this condition can be fixed in old individual? Thank you, Todd.
Sure. And yes, the loss of compliance, the loss of elastic tissue is actually a decrease in the extracellular proteins, the extracellular matrix. And because of that loss of elasticity in those proteins, that underlies the loss of compliance. They've not found an effective way to diminish that. And should they ever successfully find a way to diminish that, they're going to make a lot of money because that is the holy grail for looking at how to reduce the harmful effects of aging. So many of the harmful effects are tied to that loss of elastic tissue. And so that's an area of significant financial interest to pharmaceutical companies. Now, the one thing that has been shown to slow the rate of that loss is exercise. The trouble with exercise is they can't put it in a pill and sell it. So the pharmaceutical companies have no real interest in promoting that because they can't make any money out of it. But of all of the approaches to slow the progression of aging, exercise remains the only one that's exercise and caloric restriction remain the ones that are the most promising.
Okay, Melvin.
Thank you, Professor, for the opportunity. Thank you for the lecture. You said earlier that child is not a small adult, and it has different physiology of the body than an adult. When you're aging, several things declines, like maybe the growth rate. The child growth rate is greater than the adult. And while you're aging, some elastic tissues lose its elasticity. I just want to ask about what changes in the physiology of the body and how these changes cause this decline, and how body know how to maybe lowering this body growth rate. Like when you're aging, it's when you become a teenager, it's going to slowly decline this growth rate. Thank you.
Right. Sure. I'll take two different periods of very rapid growth. One is an infant and one is around puberty. So as you look at the hormonal profile in infants, their IGF-1 levels are very, very high. When you look at and that seems to be mediating a lot of the growth rate. When you look at the changes with puberty, they're much more tightly coupled to the estrogens and testosterone that accompany puberty. For example, the estrogen and testosterone are responsible both for stimulating the long bone growth, but also for initiating the closure of the epiphyseal plates. So the same process that starts the bone growth becomes self-limiting because it starts the process by which the long bones lose their ability to increase in length because of the closure of those epiphyseal plates, the growth plates. The consequence of that is that individuals reach a maximum of where they're going to be. As you look at individuals who have had hormone imbalances, this was prominent in the early 1900s. Individuals with gigantism had a growth hormone secreting tumor, and these individuals grew over 7 feet tall. Individuals who completely lacked growth hormone would not grow would grow to maybe 3, less than 4 feet. So the growth hormone is responsible for a whole lot of that growth and maturation. But once you hit puberty, the growth hormone is no longer going to be responsible for the height growth, for the long bone growth that is going on. Now, what can you do about it? Not much currently. If the individuals are growth hormone deficient, you can treat that with supplemental growth hormone. But like for one of my grandchildren, they're in the 5th percentile on the height weight charts and have been ever since they were born. They're just going to be a 5th percentile size adult. As long as the growth stays on the curve, there's no need to intervene. If they would ever drop off of that curve, then you would look for a reason of what's going on. Why are they no longer growing at the rate that the charts predict that they should grow?
Okay, thank you, Prof. Inshira, please.
Okay, right. Okay, sorry, first of all, for the lecture. I'm wondering, since aging occurs due to a decrease in hormonal ability, and if that's the case, does the hormone treatment works or even effective at all and safe as a way to prevent aging? Thank you.
Sure. There's been a lot of work both on growth hormone and especially IGF-1 to try and see whether or not that can retard the progression of aging. It does decrease the rate with which skeletal muscle mass is lost. And so there are individuals who use that to try and preserve their muscle mass well into their 70s. There's an actor, Sylvester Stallone is a US actor that abuses growth hormone to try and maintain that lean muscle mass. But the harmful effects of that, it doesn't only impact the size of muscle mass, it's got a lot of other metabolic effects, which are not good. So his chances of living a long life diminish, even though he's been able to maintain muscle mass by using the excessive amount of growth hormone. Whether there's research on that, and the current research does not really support that as a viable way to keep function well into adulthood. Resistance exercise, however, has much the same effect without the harm that growth hormone can do. And that's been very useful at diminishing the onset of aging and infirmity.
Okay. Maybe now Zaki and Izati.
Okay, thank you, Professor, for the lecture and the opportunities that we both have our own question. So I just want to ask that why do older adults often feel need to sleep more than younger adults? And how does aging affect sleep regulation in the brain? Thank you.
Okay. So one of the characteristics of growing older is you do not sleep as soundly. So your period of time in REM sleep is diminished. And of all of the phases of sleep, the REM sleep is the one that is biologically necessary. So these individuals, even though they spend more time asleep, the sleep is not nearly as restful. So that accounts for why they try to sleep more, because even though by the clock, they're sleeping more, by the time they spend in REM sleep, they're a little sleep deprived. So that accounts for some of the increase in sleep as you age. And the second part of the question?
Yeah, thank you, sir. So, okay, sorry. So my question is, as far as I know that
there's a part of DNA called telomere has a relation with aging. And my question is why when DNA do replication, they cannot copy the whole chromosomes, which is making telomere shortening. So why DNA cannot copy the whole chromosomes during replication? And is there any way to prevent telomere shortening? Thank you, Professor.
Okay, so the whole process of replicating the genome is very complex, lots of room for error, and lots of mechanisms to try and fix those errors before they get encoded into the next version, the offspring cell that happens. The telomeres are at a point where the correction machinery does not deal with them nearly as effectively. So there's a much greater chance for error to show up in the telomeres at the ends of the DNA segments. And because of that, the errors often result in a shortening of those telomeres. So as you look at cells that are in their 7th, 9th generation, they will start to lose some of the original telomeres that were on the 1st generation cells. That doesn't seem to be harmful, but it does seem the rate of loss of those telomeres does seem to set an upper limit for how many times a cell can replicate before it cannot replicate anymore. And that is, again, an area that's being looked at very heavily because finding the cells that are still in the undifferentiated cell that can replace the cells which have lost their ability to continue to replicate is a really active area of research and a promising area of research.
Okay, thank you, Prof. Maybe now from Amirah Yasmin and continue to Renaldi and Firda.
Okay, thank you, Professor. I would like to ask a question. I see that many elderly people often feel excessive anxiety. Is this related to physiological changes in their limbic system? Thank you.
Okay, you say many elderly people are, I missed some of the words. Many elderly people
feel excessive anxiety.
You're breaking up a little bit. So you're asking something is changing in the limbic system because the elderly people are
Feel excessive anxiety, Professor.
excessive anxiety.
Yeah.
Okay, thank you. Part of the anxiety is a loss of awareness of a loss of ability. I know I find it very frustrating that I can't do things that I used to be able to do. And because of that, you're aware that things are changing around you, and it's not a comforting feeling. So it's not necessarily the limbic system is involved, but it's more the awareness that things that you used to be able to do, you no longer can do. Things that I used to be able to lift by myself, I now can't. And coming to grips with that loss of function takes a little while because I'm a fairly independent person. So when I went for my physical examination, I hadn't seen a physician for about 4 or 5 years because I was healthy. And so I went to go see my physician, who was one of my students. And she said, why are you here? I said, because my wife made me come in. And she says, well, do you have any complaints? I said, I'm just not as tough as I used to be. Things that I used to be able to do, I can't do anymore. Things that used to not leave a bruise, now leave a bruise. And I'm just not as tough as I used to be. She goes, you're getting older. I go, yeah, I figured that part out myself. So I see that more as just frustration and loss of control for things that they used to be able to do by themselves that they no longer can. And that loss of independence can be very frustrating.
Okay. Maybe Renaldi, please.
Okay, the first, thank you for the opportunity. I have a question. The question is, I've seen several literatures that stated in older women, estrogen level is decreased and often lead to of the osteoporosis and how to do that. Thank you, Professor.
Sure. And as you look at what happens with menopause, the ovaries stop responding to the FSH and LH coming down from the pituitary, and because of that, they decrease the estrogen and progesterone production. Estrogens are protective for the cardiovascular system, so women of childbearing age have much lower cardiovascular diseases. After they hit menopause, they start to catch up with males in terms of the incidence of cardiovascular disease because they've lost that protective effect of estrogens. Osteoporosis is accelerated by that loss of estrogens because estrogens are growth hormones and they help with the deposition of calcium into the bones. So yeah, osteoporosis is more pronounced in females post-menopause. And in the US, there are clinical studies which show that you can restore calcium to bones which had been weakened. Now, the downside is you don't know what else you're doing when you give that estrogen. It's got many more hormonal effects than just bone deposition. So they're watching carefully through clinical trials to see whether this is a net gain or not. And for the cardiovascular changes, the information's been a bit of a wash. It does not seem to restore the protective effect for cardiovascular diseases, but it does seem to help with the osteoporosis.
Okay, thank you, Prof. Maybe Firda, please.
Okay, firstly, I would like to say thank you for the change, Professor. I have been curious about one thing. Can external factors actually affect someone's lifespan? I mean, does that mean the elder who live in higher places with much more cooler temperature actually has longer lifespan and healthier condition than the people who lives in a much hotter temperature? Thank you, Professor.
Okay. So there's been a whole lot of work on the individuals from different populations. When you look, there are pockets of longevity around the globe. So it's not only at altitude or things like that, but it seems to be tied more closely to the types of food that are consumed and the total amount of calories that are consumed. As you look at the individuals who live into their hundreds, the centenarians, they tend to, because culturally, food availability, whatever, be on that caloric restriction side of the food intake. The foods that they do ingest are not heavily processed, so not a lot of food preservatives, not a lot of things of that nature. It's also relatively what would be considered in the US a protein restricted diet. They don't ingest nearly as much protein as individuals in the US ingest. So there's a combination of dietary features that all seem to figure into these populations of centenarians, of people who live very long. I've not seen it categorized by individuals living at altitude or things of that nature. I've seen it more tied to the dietary and exercise characteristics of that community.
Okay, thank you, Prof. Maybe the last section question section to Maria, Ihsan, and Aditya. Maria, please.
Okay, sir. First, I would like to say thank you for the opportunity. I would like to ask about recently a detox program from Koh Samui, Thailand has gained popularity. It claims that its detox can slow down aging, and some people even say it has helped them overcome serious illnesses and regain mobility. For example, I have heard stories of individuals with terminal diagnosis living longer than expected, and people with palsy walking again after taking a certain oil from that program. So, from a medical perspective, is there any truth to these claims? Thank you, sir. Thank you, Professor.
Sure. And I need to begin with saying that the traditional medicines, when you look at Chinese traditional medicines, they're supported by multiple centuries, if not millennia, of experience. So there is much more to be learned from the compounds which have been identified culturally as promoting either cures for a disease. When you look at as you would cite a specific example like the one you cited, I'm always cautious until I see a controlled study of the individuals and ideally a cross control study. Because if 100 people take it and take a drug and one of them shows a beneficial effect, that person is going to be the one who says, I took this drug and I got a beneficial effect. A placebo may have had the same effect. He may just be the 1 in 100. But because he's attributing it to the drug, that then gets a lot more publicity. There's something, I forget, there's a statistical term for it, where once you buy a pair of sneakers, you look around and suddenly everybody's wearing the same pair of sneakers. The incidence of people wearing that hasn't really changed, but now you're looking for it and you recognize that, and that reinforces the idea that, oh, everybody's now wearing this particular piece of clothing or that particular car or something of that, the sampling bias, a recall bias. So I don't want to say that there's nothing there, but I'm always very cautious until I see a controlled study documenting the effectiveness of these compounds. I do know I had a professor from Surabaya, Professor Adrianta, come over and work with me, and he brought Morita, which is a drug that's used to treat kidney stones of traditional medicine. And we did a study for it, and it dramatically dropped the urinary calcium levels. So there's a good reason why it was working. And the fact that, it's used as a traditional medicine from my bench research side of life says that's a good reason to look at it for this particular application. So I don't want to sound like I'm downplaying the effects of traditional medicines or traditional treatments, but I do think they should be subjected to rigorous study before they become widely recommended for use. Does that make sense?
Okay, Professor, thank you.
Okay, Ihsan, please.
Okay, before all, thank you very much, Professor, for the opportunity. So I have a question that is there even a true date from age? So when of course when people gets old, every function decreases and system goes haywire as it is a natural occurrence. But but is there even a times a case when someone just gradually dying because of the decreasing function of the overall body is gets too much too bad so that it cannot even maintain life anymore and biologically when that happens is that when humans are reaching their limit on maximum possible age for maximum possible lifespan because I have heard that people saying that humans can only live for 120 years, 140 years, and 150 years, but some others can say that humans can live as long as 310 years or even older. Is there even a limit on how long can humans live?
Sure. And the data that I've seen seems to cap out at about 120 years as the projected maximum lifespan for humans. Um, that represents the upper limit for where lifespan can be, and it's going to be a combination of both genetics and lifestyle in order to get anywhere close to that age limit. Now, what is finally going to why it can't go beyond 120 years? The progressive loss of function of the heart, of the lungs. It's not just one organ system that comes up short. It seems to be all of the organ systems gradually lose their function with age. So it's not like if it was just the kidneys, then you could put the individual on dialysis and persist for a longer period of time. It seems to be multiple organ systems seem to all have that same 110 to 120 year cap on what is the longest they can maintain function. A lot of that is because while some organs like the liver can reproduce new liver cells, a lot of organs cannot. And when there's damage to the cell, it is replaced by fibrous tissue, which does not have the same function as the cell. The one exception to that is there seem to be partially differentiated stem cells in tissues like the heart, which can become activated. And if they can get those to activate more quickly to replace damaged tissue than the fibrous tissue, which grows in to replace it, then that would cause viable cardiomyocytes to regrow in an area where there is damage. But yeah, the number I've seen seems to be about 110 to 120 years, and it's limited by multiple organ systems, not just one.
Okay, Prof. Maybe the last question from Muhammad Aditya.
Thank you for the opportunity, Prof. I see a lot of athletes today use steroid to get bigger muscle and to increase performance. The question is, what the effect of steroid for our health, and is it affect our aging process? Thank you, Professor.
Sure. And the steroid abuse, particularly for individuals doing powerlifting or things which involves high muscle mass, is an unfortunate reality. The harmful effects of steroids are multiple. The biggest one is cancers. As you stimulate these cells to grow, every time the cells replicate, you increase the risk of transcription error, which will result in a cancer. When you look at the athletes who have done this, they generally die in their 50s because of liver failure, because of cancers. So the steroids, the anabolic steroids are effective growth hormones, but you pay the price. The improvement in performance is followed by a very long list of risk factors. so that you are not setting yourself up for a long life.
Okay, thank you very much, Prof. Maybe it's been late night in US and Prof need some rest. Maybe Prof Irfan also like to share an insight, Prof. Prof Irfan, Prof.
Yeah. Prof. Irfan is also on US time zone, so it's 10:30 at night where we are.
Yeah, that's right. Okay, maybe we can close the session. Thank you very much, Prof. Robert G. Carroll, for such an insightful session. I would like to extend my gratitude to all participants for your enthusiasm and engagement. Or maybe you have some closing remarks for us and student, Prof, before we close this session.
Sure. First, thank you for the opportunity to speak with you. I've greatly enjoyed my interactions with the students from Palembang, and I regret that I'm not there in person to get to meet you and spend more time with you. This is an exciting time to be a student. The world is changing underneath our feet. We have no idea what artificial intelligence is going to do, how things are going to change. But the one thing that you can be sure about is that as you're learning to do things, the interpersonal interactions are the ones that cannot be replicated by a machine, by a computer, anything like that. So as you're learning your skills to practice medicine, recognize the importance of developing the ability to interact with your patients, with your colleagues, because that's what's going to serve you best in the long term.
Okay, once again, thank you very much, Prof, for your such an insightful session. And we hope this session has been valuable and inspiring for everyone. Have a wonderful day, and we look forward to see you at our next
Okay.
session. Say bye bye.
Ramadan Mubarak. Bye
Yeah.
bye.
Bye bye. Say bye bye. Unmute, please.
Thank you, Professor. Bye-bye.
Thank you, Professor.
Thank you.
Professor.
Prof.
Bye bye. Bye bye, Prof.
Thank you, Professor.
Bye bye, Prof.